ITLS review questions. Exam questions. A 27-year-old male with blunt chest trauma from a motor vehicle collisions was successfully intubated at the scene. While ventilating the patient, you note resistance with an absence of right chest wall movement. You should suspect a tension pneumothorax. Which of the following mechanisms of injury does not commonly cause damage to the spinal cord? Lateral stress. Management of penetrating abdominal injury with shock should include underscore 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 underscore. Oxygen via non-rebreather mask. In a rear impact motor vehicle crash, which area of the spine is most susceptible to injury? Cervical. Prolonged scene times may reflect ineffective team collaboration. Indications for applying a traction splint include all the following except to underscore 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 underscore. Reinsert exposed bone ends back into the soft tissue. Which of the following chest injuries are most common in children? Pulmonary contusion / tension pneumothorax. Which of the following is true about electrical burns? Extent of injury is related to current's path through the body. Which of the following sets of vital signs is most compatible with a diagnosis of isolated traumatic brain injury with increasing intracranial pressure? BP 170/100, P50. According to U.S. federal law, to whom should all possible exposures be reported? Your designated infection control officer. What is the most common cause of spinal injury? Motor vehicle collision. What should be your first priority in a case of external liquid chemical burns? Copious irrigation. For which disease are alcohol-based cleaners ineffective? C. difficile. Which of the following indicates a state of hyperventilation? An end-tidal carbon dioxide level less than 30 mmHg. Which of the following injuries would change a trauma patient's transport classification from stable to load and go? Pelvic fracture. Findings during the ITLS primary survey include an alert patient complaining of chest wall pain and dyspnea, unlabored respirations at 16-20 bpm with good tidal volume, strong radial pulses at a rate of 100 bpm, good skin color, flat neck veins, a bruised right chest, and possible diminished breath sounds on the right. After administering oxygen and packaging, the patient is transported. During transport, the patient complains of increased dyspnea, and then becomes unresponsive to voice. He is now noted to have rapid, shallow respirations, cyanosis, and absent radial pulses. What should the rescuer do next? Repeat the rapid trauma survey. An unconscious 18-year-old male is involved in a motor vehicle collision. You find him unrestrained behind the bent steering wheel. He is unconscious with cool, pale, and clammy skin. Vitals are BP 90/40, P 120 and 30, and are 30 and shallow. Your assessment reveals that he is blue around the lips, his distended neck veins and tracheal deviation to the right. He also has an asymmetrical chest with absent breath sounds on the left. You should suspect tension pneumothorax. The terminal end of the airway where gas exchange takes place is the alveolo-capillary membrane. Which of the following statements is true regarding carbon monoxide? Breathing 100% oxygen displaces it from the hemoglobin molecule. How should an amputated part be managed? It is placed in a plastic bag and then placed in a container of ice and water. Which of the following provides examples of special situations that may require alterations to normal SMR techniques? Pediatrics, geriatrics, pregnancy. Why is hepatitis B vaccine desirable over hepatitis B immunoglobulin? Lifelong protection. Which of the following is least likely to cause hypoxemia in a trauma patient? Bilateral tibia fracture. You have placed an NPA in your patient and now observe mild hemorrhage from the nares. You should leave the NPA in place so as not to disturb the clot or reactivate bleeding. Which of the following separates the lungs from the chest wall? The visceral and partial pleura. Early symptoms of compartment syndrome include which of the following? Pain and paresthesia. Which finding requires interruption of the ITLS primary survey? Complete airway obstruction. Which of the following statements regarding cardiac arrest in the pregnant trauma patient is true? Management of the airway and hypoxemia are vital to the potential survival of mother and child. Common mechanisms of injury for the pediatric patient include all of the following except falls. Which of the following statements is true regarding partial thickness burns? They are characterized by blistering and significant pain. Management of evisceration should include underscore 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 underscore. Moist dressings. If an extremity is severely ungulated and distal pulses are absent, you should underscore 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 underscore. Apply gentle traction in an attempt to straighten the extremity. The most common cause of traumatic cardiopulmonary arrest is hypoxemia. Which of the following is true about impaled objects? It may be removed if it is in the cheek area of the face. Management of penetrating abdominal injury with shock should include underscore 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 underscore. Oxygen via non-rebreather mask. Which of the following forms of hepatitis are healthcare workers at greater risk of contracting due to their frequent contact with blood and needles? Hepatitis B. Which of the following is not a precaution for the prevention of infectious disease? Coughing into hand. Hyperventilating a patient is recommended in which one of the following? Cerebral herniation. Which of the following statements about pediatric head injuries is false? Brain injury in a child is uncommon if there is no skull fracture. The primary purpose for providing SMR is to minimize spinal movement to avoid aggravating any spinal cord or column injury. All of the following pre-hospital traumatic cardiopulmonary arrest situations may be appropriate for withholding or terminating resuscitation except apparent advanced age of the patient. In the elderly, injuries to the chest are most likely to cause serious problems due to circulation to the pulmonary system decreases. Which of the following is considered a blind insertion airway device, BIAD? King airway. Which of the following trauma situations would be considered load and go? Patient with abdominal tenderness, clammy skin, blood pressure of 100/70 mmHg, and pulse of 130 bpm. Why are physical restraints utilized on a trauma patient? To obtain the patient's cooperation. Findings during the ITLS primary survey include decreased lock, clear airway, rapid, very shallow respirations, cyanosis, weak, rapid radial pulses, flat neck veins, and paradoxical movement of the right lateral chest wall. Which of the following procedures should be performed on the scene? Assist ventilation, administer high-flow oxygen, and stabilize the flail segment. Which of the following is a potential circulatory cause of traumatic cardiopulmonary arrest? Tension pneumothorax. Special cleaning agents are not required for HIV because underscore. The virus cannot live outside the body. Which of the following injuries would change an otherwise stable trauma patient's category to load and go? Bilateral femur fractures. When treating a critically injured child whose parents are not on scene, the pre-hospital provider must do which of the following? Begin treatment and transport the child to the hospital, documenting that parents/legal guardian were not available to provide consent. When performing the ITLS primary survey, the team leader may minimize errors by delegating interventions. Which of the following is considered one of the 4 essential components to maintain normal perfusion? Increases. The percent of oxygen that can be delivered with a bag valve mask with oxygen flow of 12 to 15 lpm but without a reservoir bag. 40 to 50%. A 54-year-old male is involved in a motor vehicle collision. The steering wheel is bent. During your initial assessment, you note his skin is pale, radial pulses are present, and breath sounds are clear. The patient is tender over his sternum and complains of chest pain. Which intrathoracic injury should you suspect given the above findings? Fluid levels. In which of the following tasks is it recommended to wear a mask? Bleeding control with spurting blood. Hypoventilation is best described as PaCO 2 above 45 mmHg. An adult male in cardiac arrest secondary to blunt force should initially be managed with management reversible causes. In which of the following situations should an emergency rescue be used? Presence of toxic fumes. Which of the following findings would be a reason to interrupt the ITLS primary survey? Airway obstruction. In a patient with significant hemorrhage, the first intervention should be to control bleeding using direct pressure. Which of the following statements about pediatric head injuries is false? Brain injury in a child is uncommon if there is no skull fracture. Which of the following injuries does not benefit from specialized burn center care? 10% BSA partial thickness burns to the thigh and abdomen. Why is neutral alignment of the cervical spine considered important? It aids in the airway management and provides more comfort to the patient. During a football game, a player is struck hard in the right flank by another player. He is writhing on the ground in severe pain. He is most likely to have an injury to his kidney. Traumatic injury to which organ and most likely to result in peritonitis? Kidney. A 12-year-old softball player slid into second base and jammed his foot/ankle. When he was unable to continue playing, his coach called EMS. Upon arrival, you find now shoeless male on the bench with an ice pack on his ankle. His breathing and pulse are noted to be just fine, and there is no external bleeding. What should be done next? Perform a focused exam. Why is spinal motion restriction, SMR, preferred over spinal immobilization? It more accurately reflects proper treatment and reality in the pre-hospital environment. Which of the following anatomical changes increase markedly after the age of 60? Respiratory system. Your management of the traumatic cardiopulmonary arrest patient should include all of the following except completion of all procedures prior to patient transport. How many vertebrae does the thoracic vertebrae consist of? 12. Pain in the left shoulder may be referred from an injury to the underscore. Spleen. When you are presented with a patient with excited delirium, EXD, your first priority is to ensure safety for all responders and the patient. What should be the first action to take when exposed to a potentially infectious fluid? Wash the area completely. A stab wound to the right upper quadrant is most likely to involve the underscore. Diaphragm. Which disease is associated with a severe cough for more than 3 weeks? Tuberculosis. Priorities of assessment for exsanguinating hemorrhage are underscore. Control bleeding, airway, breathing, circulation, CABC. 5 patients have been struck by lightning while at a soccer match. 2 are apneic, and 3 are awake and talking. You and your partner triage the victims and await additional resources. What should be your priority? To attempt resuscitation on the 2 apneic patients. The blood loss from one femur fracture may be as much as underscore. 1000 ml. Your patient reports being in a high-speed motor vehicle collision 2 days ago. She was the driver of the vehicle, and she was wearing a seat belt. She notes increasing abdominal pain together with the onset of vomiting and fever today. Your assessment reveals a seat belt sign and diffuse abdominal tenderness. You are most concerned that this patient is experiencing peritonitis. What is the most common cause of maternal death following a motor vehicle collision? Head injury. Which of the following assessment findings is associated with neurogenic shock? Decreased pulse, normal skin color and temperature. Normal EtCO2 is 35 to 45 mmHg. Which of the following is found in the true abdomen? Small intestine. Routine use of hyperventilation in the traumatic brain injury, TBI, patient will cause vasoconstriction and increased cerebral ischemia. Which of the following findings would not make a patient difficult to ventilate with a bag valve mask? Multiple nose piercings. One rule of splinting is to underscore. Immobilize one joint above and one below the injury site. A 4-year-old female is unconscious after falling off a bicycle. Which of the following is the best method to open the airway? Modified jaw thrust. Which of the following is a sign that your patient has transitioned from compensated to decompensated shock? Hypotension. When tilting the backboard with a pregnant patient secured to it, which of the following should you be most concerned about? Risk of fall. In a patient with a decreased level of consciousness, When is the Glasgow Coma Scale first performed? At the end of the rapid trauma survey and while in the ambulance. Which type of mechanism of injury is fetal mortality rate of 40 to 70% associated with? Penetrating injuries. Which of the following statements is false regarding pediatric burns? The palmar surface is equivalent to 3% BSA in children. The ability of the lungs and chest wall to expand and therefore ventilate a patient is known as compliance. Hemostatic agents applied directly to the source of bleeding must be used in conjunction with direct pressure to the wound. An adult patient has burns to the anterior chest, abdomen, left arm, and left lower leg. Using the rule of nines, you estimate his burns are at _______% BSA. 36. Which of the following statements is true? The primary functions of skin include a protective barrier, sensation, and temperature regulation. When are tourniquets used to manage bleeding? If you are unable to control the bleeding using direct pressure. Which is the best initial management of high-space shock in acute trauma patients? Rapid, safe transport to a trauma center. Injury to which area of the spinal cord may cause a neurogenic shock? Cervical or thoracic cord injury. TXA is unlikely to be of benefit to the patient is given beyond how many hours of injury? 3.